Welcome back. It's Dr. Jen Boney, better known as Doc Jen Fit, Doctor of Physical Therapy, and I am the owner and founder of Jen Health, our app and platform for all things movement-based pains and aches that you might be having within your body. And today, I want to help you with achy hips you might be feeling during pregnancy. Now, I am pregnant myself, so this is something that I have been working on and doing myself, from active mobility to some stability exercises, because what's happening during pregnancy is we have a lot of movement in our pelvis. And we might think these aches and pains that are coming up, oh, I need more stretching, but actually I need more stability and support to support these new sensations that are popping up. So that's what I want to do with you today. When we go into our flow today, I am going to use a yoga block. If you do not have a yoga block available, you can use like a small pillow or a pillow that you can fold, something that creates almost the same kind of height. It's okay if it's a little squishy. It's just going to kind of change it. So you might have to stack a little bit, like towels or something else if you need something a little bit firmer, but we'll get right into it. So we're going to start with hip circles to adductor rocks. Now, these are some of my favorite things to really open up the hips, not only actively, but we get a little bit of a passive stretch into that inner thigh groin area, which is usually where we get a lot of symptoms, right into that pubic symphysis area. So we're going to kick that leg back, squeezing from the glute. So what I want to make sure is that you're pressing into the ground right here. Okay. Really push into your fingertips. It's going to take some pressure off your wrist, and we're going to help to set the core. Okay. So I don't want any movement in the back at all. So try to move that pelvis, find middle, press into the ground, and now we're not going to move the spine. Okay. We're going to kick that heel up as high as you can without moving that spine, and then lift that knee as if you're going over a cone, and then bring that knee up to the side, and then kick that foot out flat. Now have a slight bend in the knee so it's not completely locked out. And with the back straight, I want you to think of tailbone almost reaching up for the sky as I rock back into a groin stretch. So my tailbone is up, so I'm not rounding. And then I come back and I'm going to lift that knee up, bring that leg around, squeeze in that glute, and then bring it down, and we'll switch. So squeeze into that glute, reach that knee up and around, knee comes up, foot out. And we, with a slight bend, it's not a huge bend, but a slight bend, keep that tailbone up. And that should feel so good in that groin area, right? To just get that kind of stretch, and we're getting that active mobility all around that hip, because we have some more mobility in those hips and pelvis area in general. So learning how to use that newfound mobility and create some stability. Now, when these kind of aches and pains pop up, I want you to remind yourself that these are new sensations that the body is not used to feeling, because you're not pregnant all the time. Okay. Pregnancy comes with different hormones, which are necessary to start to create space for baby. So we just want to keep telling the body, it is new. It is safe. You're not broken. Nothing is wrong. This is all what is meant for my body. Keep it positive within your brain. I know pain can feel scary at times, and we start to say, what's wrong? Why am I feeling this? But it's just your body sensing a new sensation. So how do I respond to that? Every time, if I'm slumped into the couch and I get up and I feel that zing, I say, oh yeah, that's new. My body has more movement. It's not used to it. Okay, now we're going to get this block. I'm going to place it between my legs. I'm going to have my legs kind of squeezing it. And now I want to rock forward. My feet are going to come together. I'm going to rock back, and my feet are going to open as I squeeze the block. Now, I don't want to round here. So I want to think of that tailbone again, popping up to the sky, trying to get into those hips as much as possible. So lean, feet together. And big inhale. Open up that pelvic floor. Exhale, feet together. Inhale. Open, rock back. Exhale. Inhale. Exhale. Inhale. Hopefully you start to feel a little bit more movement in those legs. Open, open, open. Inhale. Good. And then we'll move that back. Oh, actually, I'm going to keep that with me. Okay. So for this next one, we are going into a modified Copenhagen plank. Now, I do Copenhagen's during my workout on a full bench. It's a little bit harder. If you have the strength within your inner thighs, you can always do that. Otherwise, this is at least where we're working up to. You want to think of creating a plank position. So a straight line from your shoulder all the way down to your knee. So you're going to try not to have a bent hip here. So squeeze that glute, almost rotate that top hip over. Okay. And now from here, we're going to start by letting that leg stay on the ground. And I'm going to push my top knee down into the ground. And I'm going to hold here. 5, 4, 3, 2, 1, and come down. And again, press, hold 5, 4, 3, 2, 1, come down. If you can allow this knee to come up with you. 5, 4, 3, 2, 1, down. Bring that knee up. 5, 4, 3, 2, 1. And the hardest one, which I probably can't even do right now, is lifting this entire leg. So you lift up. 5, 4, 3, 2, 1. Okay, I can do it, but it's hard. And then we'll switch to the other side. Okay. Now you might already be feeling like, whoa, there's a lot of sensations happening. We're strengthening. We're talking to those new sensations within the body. We're saying it is safe. You are strong. You got this, body. I know it's new. Okay. We know it's new, but that's okay. We can work with these new sensations. Create that straight line, squeeze that booty, press down, start here. 5, 4, 3, 2, 1. Even if you could lift all the way on the other side, you don't know if that's true on the other side. Okay. Because every leg is just a little bit different. 5, 4, 3, 2, 1. Then you can start to say, okay, can I lift this knee with it? 5, 4, 3, 2, 1. Again, press. 5, 4, 3, 2, 1. And last one, if you can, lift. 5, 4, 3, 2, 1. Woo! Really getting things moving here. Okay, last thing, we're going to stand, and if you can, find a wall, some empty space. You don't need a huge wall, just enough space to kind of kick your back foot into. I'm going to actually use the couch rather than moving to a wall, but either way, something sturdy that you can press your foot against. Okay, standing against the wall, you're going to be about a foot away, maybe a little bit more, okay? And we're going to do almost like a single leg deadlift position. But we're going to kick this back foot into the wall. So you're going to kick back and almost think of drawing your heel up the wall. It's not literally going to move. Okay. And what we want our knees basically like in line. So if your leg is too far back or too far forward, you know, you got to adjust that foot a little bit. Okay. But that foot is pressing back and up. So I get my hamstring already working here. Now I'm going to draw my hips back. So I keep a bend in this knee. So my hip is reaching for the wall. And now I should already feel my glute loaded. And then I am going to rotate. So I'm going to rotate and drop this knee down, dropping and stretching into this hip as much as possible. So stretch, stretch, stretch. And then I'm going to draw this hip down straight into my knee, straight into the floor as I raise my other hip up, trying to keep this knee out over my ankle. I'm still putting pressure on the wall with that back foot. And then again, I stretch, open this hip, drop it into, so dropping that knee and then pressing straight down, press, 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 and you should feel that glute fire when that happens. So we're putting that glute on stretch, almost opening up that back pelvic floor and then pressing down and opening. And if you're like 3 is all I have, you can stop right there. Otherwise, we'll do 2 more. Stretch. Press straight down, open. Ooh, my glute is on fire. Stretch, press, and open. And that is gaining stability through that mobility of that hip and pelvis, which is so great, right? Okay, now again, kick into the wall, pull up. So I'm kicking back and pulling up. Hamstring on, booty back into that wall. And now from here, dropping, rotating, opening up that glute, press straight down, rotate that hip up, keep that knee out. And rotate straight down. You might need support or hanging on to something at first. Open, 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 open. Press straight down, rotate. Woo. I'm getting a little shaky. Keep that back foot pressing and pulling. It's going to help to create that posterior chain stability that we're looking for. Rotating in that hip. I know my chest is rotating, but only because I'm dropping in these hips. So you're really trying to keep the rotation from these hips. Okay, and the chest is just following. Ooh, you can stop there if you needed to. Or we got 2 more. And the more you work on this, the better it'll be, but you should still feel that burn because I work on these all the time. And oh my goodness, are my glutes burning. Now, if you want more like this is where I highly recommend jumping into our full body low impact plan. This is the plan that I do all pregnancy because it helps me to feel supported all around my hips and core as I go through pregnancy. It's full body strengthening. It's really working on all angles of that pelvis. And I highly recommend just start a free week. See what it's like. There are 3 phases to follow. I did this pregnancy and postpartum, and it's been the best thing for me. Don't forget, if you love what you're learning, I have so much more in stock for you. So hit that subscribe button, check out the other videos I've done in the past, and leave any comments of any suggestions that you have for videos in the future. And I can't wait to help you feel incredible and amazing within your body.